computer. All right, thank you everyone for coming to our second The Doctors In event with Delray Medical Center. Today we are so happy to have William Fagan with us, and he's going to be talking about medication safety. So without further ado, let's welcome him.
Thank you, Maddie. Thank you for having me come and provide this lecture today for the library. So today I'm just going to briefly go over just medication safety, some pointers and tips on how to stay safe and using medications safely. So with that, we'll start with what we're going to discuss. So we'll talk about medication misuse and the significance of that, contributing factors that lead to medication misuse, proper medication storage, and then of course disposal. And then how the role of pharmacists, especially in retail and outpatient settings, to promote patient safety and medication safety and correct medication use. So unintentional medication misuse can lead to patient harm and additional healthcare costs. So some of this information I'm going to provide is old data because there really isn't a lot of new data, but we'll talk about that. So what causes the misuse of medication? So the simple answer is that people take a lot of drugs, and I put in parentheses they're legal because that's what we're going to focus on today. So people take a lot of legal drugs, lots of prescriptions, lots of new prescriptions, over-the-counter medications, natural medications, and vitamins. So it's important to remember that over-the-counter medications, natural medications, and vitamins should be considered medications. And just because they're natural or safe or over-the-counter doesn't mean that they cannot cause harm or lead to complications and problems with prescription medications. There's TV ads, so direct-to-consumer advertising by pharmaceutical companies. It's an effective way for them to market their medications and get them known in the public, and obviously it works because you see lots of ads on TV for prescription medications every day. Over-the-counter labels are really hard to read and difficult, which is one of my pet peeves. We'll go over some examples of that and how to look at these things and avoid any potential mistakes or mishaps. Seniors, parents get confused, so get confused about instructions, how to take medications, when to take medications, doses, 1 time a day, 2 times a day, etc. And then sometimes the written information is hard to read. And we're not talking about handwriting. Handwriting can be hard to read, but we're talking about anybody who's picked up a prescription drug at a pharmacy. You get the packet and pamphlet that comes with it. That's really small font, very complicated medical literature that's hard to read and hard to decipher for most people unless they have a medical background. All right, so in 2006, the Institute of Medicine came out with this report that 4 to 5 US adults take prescription over-the-counter or dietary supplements every week. So that's pretty much what they're trying to establish here, is that majority of people in the United States do take some kind of medication on a weekly or a daily basis. A third of those take 5 or more medications a week. It's 1.5 million by medication-related errors. This was in 2006, which has led to a lot of the technologies and a lot of the developments that have subsequently come to where we are now, especially in hospital healthcare setting with barcode administration and barcode scanning and electronic medical records, etc. Medication errors cost at this time $3.5 billion in that year of 2006. So you can see it's something that is costly to our country, and it's something that obviously causes injury to the citizens of our country, and something that we strive every day, especially here at Delray, to avoid any medication errors. So the scope of the problem. So 2 out of 3 patients, they leave the doctor's office with a prescription. So it's just that there's just so many medications and so many prescription drugs, which is a good thing because science has come drastically forward, especially in the last 30 to 40 years, as far as the availability of medications to treat disease states that were otherwise not really treatable in the past. So it's actually a really good thing. It's just like anybody who knows statistics, the more variables you have, in this case, medications, the more probability of committing errors occurs. So it's just a fact of numbers. So 3.4 billion prescriptions were filled in 2005. It's actually way more than that now. And 40% of the US population receive 4 or more prescriptions every year. So again, this is all good things because it means that diseases and, infections and, problems that we encounter in our health are usually pretty treatable with common medications. This is something that has actually been a big scope of us at Delray and a big scope nationally is antibiotics and antibiotic resistance. And you may have heard in the news a lot of talk probably about 3-4 years ago about antimicrobial stewardship or antibiotic stewardship. So the United States actually took a stand that it was going to reduce its annual usage of antibiotics to prevent antibiotic resistance. So this wasn't just in healthcare settings, this was in all settings. So a lot of people may or may not know this, but the majority of antibiotics are actually used in livestock, chickens and so on and so forth, and things we buy, in the grocery store as far as meats. But the government has really kind of put a lot of regulations on that now and trying to drive down that use in the livestock because just because it's used in the livestock, there's bacteria everywhere. So, these livestock are exposed to antibiotics. The bacteria replicate, they live in soil and water. They can become resistant and then infect us as people. So that was one of the big scopes. And the second was obviously in healthcare to reduce our use of antibiotics to only use them when it's absolutely needed. So 23 million antibiotic prescriptions in this year were written for colds, bronchitis, and upper respiratory infections. So I'm not saying that some of these weren't bacterial in nature, but the majority of colds, bronchitis, and upper respiratory infections are most likely viral, in which antibiotics have no effect. So, it's kind of like overprescribing antibiotics, and it has been a big problem in the past. And then exposing people to antibiotics unnecessarily, and then, putting the antibiotics out there for bacteria to develop resistance kind of unnecessarily. So, 44% of children were given antibiotics for colds, again, mostly viral in nature, colds, 51% of adults. And then CDC says 70% of bacteria causing infections are resistant to at least one common drug. So this has been, like I said, a big issue with multi-drug resistant bacteria. And what happens is over time, if we keep using antibiotics in that same fashion, bacteria become resistant, and then it could leave us with very, very limited options to treat common infections, or, in some cases, there's really no antibiotics to treat infections, which obviously is not a good thing for us or for public health in general. So another thing is alternative medicine. So it's important to remember and think of these things as medicines and not think of them as natural and natural equaling safe, because there's a lot of natural things out there that can kill us, right? We don't, if we go out in our gardens at home, there's poisonous plants we could eat and we could die. So, just because something's natural doesn't mean that it's safe. Everything can have, adverse effects, especially at, the right doses or the right consumption. So natural doesn't always equal safe. So alternative medicine became a really popular thing. It's still a very popular thing. 106 million people use vitamins and minerals daily. I take a vitamin every day, which is fine. 44.6 million people use herbal remedies. Herbal remedies are something that I actually never really recommend for people because they don't go through, the stipulations that prescription drugs or over-the-counter drugs do as far as regulatory bodies with the FDA and good manufacturing practices for purity and things like that. So I personally never recommend these therapies for anybody. I don't take them myself, but everyone's entitled to make their own decision when it comes to that. That's just my personal preference. 24.2 million people use specialty supplements. So again, just trying to hit that there's a lot of people that use alternative medications or alternative medicines. Like I said before, natural doesn't equal safe. So for an example I have here is we have Coumadin, which is a prescription drug. It's a blood thinner. We have aspirin, which is an over-the-counter drug, which is antiplatelet, which, and kind of thins the blood. We have ginkgo biloba, which is a herbal supplement, which can cause blood thinning. And then we also have vitamin E, a dietary supplement, which is also known to cause blood thinning or has some slight anticoagulant properties. But again, if you take all these things together, you could be putting yourself at increased risk of having, bleeding, which a lot of people just don't know about. So again, that's why it's important if you have drug lists, you maintain your medication list, you have to put everything on there. All your prescription drugs, all your over-the-counter drugs, all your dietary supplements and vitamins, and anything you take that's homeopathic or natural medicine. And let your physician or prescriber know, as well as your pharmacist, to check for drug interactions. It's very important to have all these things on the list, not just the prescription medications. So here's St. John's wort is really popular in the 90s for depression, but it had a lot of drug interactions that kind of went unnoticed because at that time, this was kind of new drug or new herbal remedy, and there wasn't a lot of research involving it. But, come to find out later, it had a lot of drug interactions with HIV drugs, birth control medication, certain drugs for heart disease, cancer, depression, seizures. So again, just because something's natural doesn't mean it's safe. This is a very hard slide to read, but I just put it up there for more visualization, sorry. This is from a drug reference that we have here in the hospital that just kind of shows you drug interactions with the herbal supplements. So again, that's why it's important to put these things on your medication list if you are taking them, because there's a lot of interactions that occur with prescription medications, over-the-counter medications, and herbal supplements. And if we need to know these things to try to avoid any harm or negative outcomes because of those interactions. So direct-to-consumer advertising, it's one of my pet peeves as a pharmacist. I'm not a big advocate for this, but this is kind of the world we live in now. So the drug companies, they advertise to the public directly on purpose because they know it works. So it's kind of some interesting statistics that 78% of primary care physicians, they've been asked by their patients for specific drugs that are advertised on TV. So it makes sense. Advertising works. So we see an ad on TV and we think, oh my gosh, I have something that like that. I feel like that. Oh, next time I go see my doctor, let me just bring it up and say, hey, I saw this ad on TV for, this medication. I think I have, whatever it's trying to treat, and I think it'll help me. And you ask your doctor for the prescription. The surprising part is that in 2007, this is a Consumer Reports that did this study. They found that 67% of the doctors actually granted the requests. So again, I think sometimes the physicians just feel a lot of pressure from the patients to keep them, satisfied and feel like they're doing their job and taking care of their complaints and addressing their issues. So there's a lot of pressure on the physicians, unfortunately, to prescribe medications that, in the past, maybe they may or may not have prescribed just because of direct-to-consumer advertising. So prescription and over-the-counter medications. So this slide, we'll just kind of briefly go through what they have in common and what makes them different. So prescriptions are ordered by a doctor or prescriber. You can't just go into Walgreens, CVS, or any pharmacy and just, pick it up off the shelf. It's something that has to be ordered by prescription and it has to be dispensed by a pharmacy. So you bring your prescription to the pharmacy. And another important thing about prescription drugs is that they're ordered by a physician or prescriber for use by the person they're ordered for. And that's the only person that should be using them. It shouldn't be shared with spouses or children or friends or family or whatever. The prescription that was written for the person that it was written for is intended to be used only in that person. So over-the-counter medications, we all know this. We can, buy them without a doctor's prescription. We could all walk over to the pharmacy across the street and go in there and browse the aisles and buy whatever we want, right? Bought off the shelf in stores. But these are actually marketed and they're okay to use for more than one person. So I could go buy a bottle of Tylenol, for my home. If I have a headache, my wife has a headache, my children have headaches, we can kind of all use the same Tylenol to treat our headaches, which is one of the big difference between over-the-counter medications and prescription drugs is that, you know, we can use these in multiple people where prescriptions are only for the person that are prescribed for. So similarities, directions must be followed carefully and correctly. So one of the big mistakes that people make, especially with over-the-counter medications, could be dosing them and taking them incorrectly. Children should be only using obviously prescription drugs and over-the-counter drugs under the supervision of, you know, a parent or guardian. We don't want, you know, children going around self-medicating and taking things and, you know, because they don't know if they're going to do it correctly or if they're taking the right thing. We should always be overseeing that to make sure that, you know, the parent or guardian is ensuring that we're doing the right thing and giving the right doses, et cetera. And a pharmacist, of course, can answer questions about any medication. So whether the over-the-counter or prescription, you should use your pharmacist as a resource. Medication use issues. So these are some factors impacting medication use and outcomes. So common causes of medication misuse. So it's taking the wrong doses of a medication. You know, oh, I thought the doctor said take it once a day, or take one tablet once a day. I took 2 tablets once a day, or I took half a tablet, which, you know, we gotta make sure we're taking them exactly as prescribed. Taking them at the wrong time. So, you know, if it's supposed to be taken before breakfast, making sure we're taking it before breakfast. If it's supposed to be taken at bedtime, making sure we're taking it at bedtime. If it's with or without food, make sure we're taking it with food or without food, exactly how it's prescribed. Forgetting to take doses. So if you forget to take a dose of a medication, you know, and then you remember later on. It depends on the medication, but, you know, what to do in that scenario, but that can obviously be an impact. If we're not taking the medications, we're not treating what they're prescribed for, right? And stopping medication too soon, which is actually a very common thing with antibiotics. Antibiotics should be taken for the full duration that they're ordered for, whether it's, you know, 5 days, 7 days, 10 days. If we take them for 2-3 days and we start feeling better, feel like we're cured, we stop taking them, the infection can actually come back, and it can come back even worse, and it can come back now where whatever was in there and was being treated successfully with the antibiotics we were taking could now be resistant and require, you know, stronger antibiotics to treat. So it's very important to finish full cycles of antibiotics and not just stop after a few days. So misuse leads to treatment failure. So just some examples of, you know, if we have glaucoma medication and drops, you know, if we just stop taking them, it can lead to optic nerve damage and ultimately could lead to blindness. So we don't want that to happen. And then if you suddenly stopping blood pressure medications, you know, especially not under the supervision of a physician or prescriber, your blood pressure can go up really high, which can be bad, right? It can lead to strokes, heart attacks, et cetera. So, you know, anytime we want to, you know, stop medications or change doses, we have to make sure we do it, you know, under the supervision of our physicians, and we're not just doing those things kind of on our own. So seniors are obviously at risk for having medication errors or medication related issues, just because, you know, as we get older, you know, that's when things start to happen to us, and you know, these medications are used more in the elderly because of that, because they're older, and it's just kind of the way it is. So it accounts for the elderly are 13% of the U.S. population. So, and that's growing as you know, the baby boomers start to become of age. They account for 1/3 of all prescriptions that were dispensed. Average number of prescriptions for an elderly person was 28.5 per year in 2000. It was estimated to reach 38.5 in 2010, and it did. And then there's been about 240,000 hospitalized patients or people per year from drug reactions between prescriptions and over-the-counter drugs. So here are some of the barriers that even put seniors at more risk. Visual, hearing, and cognitive impairment. So, you know, I can't see as well as I used to. I don't hear as well as I used to. You know, maybe a little arthritis, can't get the bottles open. So if you can't get the prescription bottle open, you can't take your medication. Slower organ function. This is what we kind of really focus on, and especially here at Delray and hospitalized patients, making sure that we have the right dose for, you know, elderly patients based on how well their kidneys are working, how well their liver is working, et cetera. Labeling and packaging are difficult to read or use. So outpatient settings especially over-the-counter medications are very confusing at times, and it's hard to read the writing on them. And then lack of health insurance and drug costs. So, not everybody has health insurance, and then prescription drugs can be extremely expensive at times, which leads to people doing things that maybe they wouldn't necessarily do. I know we see this in patients here sometimes. They, can't afford their meds outside. We do their med histories and here when they come in the ER, instead of taking a full tablet once a day like they're supposed to, it's so expensive that they only take half a tablet once a day. That way they can make 1 month's prescription last for 2 months, but that's not a good thing to do in the long run because the dose that you're getting may not be effective. So, these are just some of the issues that we see here. Here's an example of overuse. So, unnecessary use of antihistamines like diphenhydramine or Benadryl, sleep aids and things like that. They can lead to falls, which can lead to bone fractures, and can also lead to, motor vehicle accidents because, if you take a Benadryl to sleep at night and then you wake up the next morning, you feel groggy, go out and drive your car and just not, your normal self and get in a car accident. So it's supposed to be very cautious when doing things like that. And then this led to 27.3 billion healthcare expenses related to falls in 2005. So here's some slides I made about over-the-counter medications. So it's a question, did you know that Tylenol and NyQuil contain the same active pain relief medication, which they do? They actually both contain acetaminophen. And then did you know that the popular prescription medications Percocet and Vicodin also contain acetaminophen? So there's a lot of branding and a lot of combination products out there that contain a lot of the same active ingredients, which can be potentially dangerous, mix if people are not really aware of that. So one of the goals I have is to try to teach people how to read over-the-counter labels to make sure that we're trying to avoid these mistakes as much as possible. So one of the things that kind of drives me crazy is that these companies know branding works, so they take their branding, which is Tylenol, which is acetaminophen, but then they use that same kind of branding name and then they attach it to different products that actually contain a lot of different combinations or different medications altogether. So for example here, there's over like 50 different Tylenol products. So there's Tylenol, regular Tylenol, there's extra strength Tylenol, arthritis strength Tylenol, Tylenol PM, Tylenol cough and cold, cold and flu, Tylenol sinus. So they all kind of sound similar, but they all could be similar, but they could all be very different as well. So what you want to do is you just want to look very closely at the ingredients that are in these formulations to try to avoid, taking something that you shouldn't be taking, or to avoid, an accidental overdose of something that you didn't realize you were taking. So here's one of the slides. I have an example here. These are two products that obviously have the same, branding name. They have Dulcolax and Dulcolax. But if you actually look really closely to the writing, one is Dulcolax laxative, and then one's Dulcolax stool softener. So when you look quickly, you could think they're the same thing, but they're actually totally different. So one is bisacodyl, which is, a laxative, which will, cause you to really have to go to the bathroom. And then the stool softener is a stool softener, which just, obviously softens the stool. But again, they look kind of very similar. They have the same name product, but they're totally different. Here's another one. So we got Maalox and liquid Maalox regular, then liquid Maalox total. So we're just popping into the pharmacy real quick to grab some Maalox because, maybe ate something didn't agree with us, or just not feeling that great. My stomach's kind of hurting. Let me take some Maalox. That usually works. We can pop in there and grab one. And then actually looking at these two products, you can see it's very easy to grab one, not realizing what it is. So what you want to do is look at the back of the products here. So I have them highlighted here circled. So if you look at that drug facts section, all the over-counter medications have to have this. It actually lists what the active ingredients are. So look at the one on the left. The one on the left is aluminum hydroxide, magnesium hydroxide, and simethicone. So this is actually the traditional formulation of Maalox. It's an anti-gas and anti-kind of heartburn medication. If we go at the right, it's got bismuth subsalicylate in it. So most people know bismuth subsalicylate as Pepto-Bismol, which is the purple stuff, or pink stuff, sorry. But what you can see, looking at the front, they look identical. But when you actually look at the back, the ingredients are totally different. You know, so you want to make sure that you're reading the back to make sure you're actually purchasing, you know, what you want to purchase. Here's another example here, kale pectate. So, you know, kale pectate, on the left is kale pectate anti-diarrhea, and you have kale pectate, but kale pectate on the right is actually a stool softener. So, you know, you don't want to get that mixed up, you know, if you're trying to treat either one or the other. So again, if you looked at the back of the package, you can see what the active ingredients were and what their intended purpose was, to try to, you know, avoid any mix-up. So safe medication use, we'll talk about next. So some common drug interactions, you know, anti-inflammatory drugs like Motrin, Advil, Aleve, or Naproxen. You should avoid those with alcohol, really because it can cause a lot of stomach problems, stomach ulcers. It could potentiate bleeding as well, but mostly for the stomach and ulcer risk. Alcohol should also be avoided with aspirin, especially higher doses, because it can cause, you know, blood thinning, like aspirin does, and can lead to increased risk of bleeding. And then blood pressure meds like ACE inhibitors, those actually increase potassium. And then you have other medications that are prescription, like diuretics or Lanoxin or digoxin, which actually decrease potassium. So you can see like these two medications, they're commonly used together, but you can see how their effects, especially with potassium, are kind of contradictory. You know, antidepressants, you want to avoid those with alcohol because you have increased drowsiness. Antibiotics, specific ones you want to avoid with like citrus fruits or anything that's really acidic. Some of them you have to take on an empty stomach. Some of them you have to avoid with calcium or antacids because the calcium and acids bind to them in the stomach and then they don't get absorbed. So it's important to just follow the labeling and prescribing exactly as prescribed by prescribers. And then aluminum antacids can deplete calcium. So especially in the elderly, if you take these things very frequently, it's important to supplement the calcium back, whether it's with a calcium, you know, carbonate or a Tums tablet or something like that. So prescription pickup. So it's kind of like some good habits to practice when you're picking up prescriptions in your pharmacy. The first thing obviously is to make sure that it is your medicine. That's why when you pick them up, they often ask you for your name and then like either your date of birth or your address. So, I mean, people have the same names. It happens all the time. So that's kind of like their double check to make sure that, you know, you are the person that this medication is intended for and not, you know, somebody else. So it seems kind of annoying, but that's actually the purpose that, and the reason that they do it is to make sure, kind of use that second patient identifier to make sure that it's you picking it up and, you know, not and the correct person. Do the pharmacy employees open the bag, compare the name on the receipt with the name on the prescription label? So again, just make sure that all the information there that's on the bags is, you know, your information. And then make sure it's your medicine. Before I leave the pharmacy, if I'm picking something up, I always check to make sure that, you know, this is the same pill that I had last month or it looks the same. Very commonly, it won't look the same because there's a lot of drug companies out there, especially with generics, make a lot of different generic formulations. They will look nothing alike, but they could be the same medication, but that's okay. You know, it doesn't hurt to ask the question. You know, if you're used to taking like a round, you know, blue pill every day, and, you know, all of a sudden my blood pressure medication is now, you know, a square orange pill, like little red flag should go up and say, wait, this isn't what I normally take. And just ask the question, say, you know, hey, is this the same medication that I was getting last month? Looks totally different. You know, majority of the time they're gonna say, oh yeah, it's just a new generic company. It's the same medication, same active ingredients, nothing to worry about. But, you know, you're the expert on what you take because you take it all the time. So if something looks different, it doesn't hurt to ask the question just to make sure and just to be safe. So what to do at home. So when you're home, it's important to keep them in the original containers as much as possible. I know a lot of people utilize pill boxes. I think pill boxes are great, or pill planners. The only thing I would say is I wouldn't put more than maybe a week at a time in any type of pill box or pill planner. Just because especially if we're going to doctor's office or doctor's visits, medications can change very frequently based on how we're responding to them or how effective they're working, et cetera. If you already have like a month or two or, a month set up of a pill box and then they change, a dose on something, then you have to go back and redo the pill box. It can lead to a lot of confusion, a lot of errors where, maybe the one that, was decreased wasn't taken out. Now you're taking more than I'm supposed to or whatever. It's just important to not set them up, for a prolonged period of time to try to avoid those mistakes from happening. Also, it's good, to keep them in the same container because then like what they actually are. If you're taking like, multiple medications every day, it's hard to remember what everyone looks like and what everyone is for. But if you keep them in the original containers that they came in, then at least they're labeled and what they are and what their intended use is. Should read the label every time you take a dose. Like our minds play tricks on us all the time. It happens, even when we're taking things out of the refrigerator, we go in there to take out the ketchup, we took out the mustard on accident. So, we do the same thing with medication. So read the label to make sure you know what you're taking. Like I said before, earlier in this lecture, make sure you keep a current list of your medications. By that, I mean all the prescription medications, all the over-the-counter medications, all the dietary supplements, multivitamins, vitamins, and all the herbal supplements. Everything needs to be on that list. So that way it's up to date and it's all inclusive and everything is there. Allergies as well, we need to know that. So and your physicians and prescribers, and they need to know that too. But not just your, drug allergies. You want to put on really any allergies you have. So your food allergies, your herbal allergies, and your drug allergies. A lot of medications are made from food products. So, if you're allergic to peanuts, for example, we have medications that are actually derived from peanuts. So we need to know that because we don't want to give you that medication if you do have a peanut allergy. So again, all allergies. Then keep your medications in a safe location. You kind of want to keep them in a place that's, if you have kids at home, you want to keep it in a counter that's, kind of unreachable by them. In a safe place where, people aren't going to come over and go rummaging through your cabinets and seeing, if you have any good medications in there that they even want to steal, especially if they're, controlled substances. And then somewhere that's, not really humid, somewhere that has a good temperature control, but really in a place that's kind of safe, dry, and cool, and away from people who can go in there and kind of have access or mess around with them. Disposal of unused and expired meds. So if you have a medication that is now expired or you no longer need it based on the expiration date, the best thing to do is to take them back to pharmacies that accept medications as like a take back program and they'll dispose of them. I know in Palm Beach County, a lot of the sheriff's offices have kind of like self-service centers in the stations where you can go in and you put these in this bin. It's kind of like a mailbox. You just put whatever you have in there and then it goes in there and then they get rid of it and dispose of it. The reason for this is because EPA has done a lot of studies and they find, medications turning up in, our water, and, marine life, et cetera. And then actually can get back in our tap water that we turn on in our homes. So to try to eliminate, all these things from ending up in our water supply. That's kind of why we want to do these. We don't want to just throw them down the toilet like we historically used to do. Don't flush them unless you really have no other means to get away with them, to get rid of them. Really don't want to be flushing medications anymore. You can also check with the local government, to see here what other options they have for medication disposal. But like I said, Palm Beach County, you can bring a lot of these back to your pharmacy, or you can bring them to the sheriff's office and they'll properly dispose of them for you. In the instance where, you do want to get rid of a med or something that and you don't have any other way to get rid of it, instead of flushing it, what you can do is you can, put it into like a plastic bag with some coffee grounds and try to crush it up or something like that. Kettle litter, et cetera, just to keep it from, running away in wastewater or rainwater, things like that. But ideally what we want to do is take them back somewhere where they can dispose of them properly. So your pharmacist, really these slides are really just kind of like very generic and very simple. Really just to sum them up, it's just if you have any questions about medications, that's what we're here for as pharmacists. We're here to help people and the public take their medications safely, answer questions about medications. I personally answer questions all the time of people. I have no problem doing that. You know, I'm of the philosophy there's no such thing as a stupid question, especially when it comes to like our safety or our health. So, you know, make sure that you're using your pharmacist, asking them the questions about your medications or any over-the-counter meds or dietary supplements, etc. Working with them to make sure that we avoid any medication errors or any medication adverse events or drug interactions, etc. So with that, that's really all I have for today, unless anybody has any questions. Maddie, can you hear me?
Yeah, I can hear you. I don't see any questions either on here or on Facebook, but I wanted to thank you again for coming in. I think this was really helpful. And there's honestly so much about the pharmaceutical industry that is confusing to people. So really, thank you so much for giving us this information. And yeah, I think that's about it. Did you have anything you wanted to share or anything else, or?
No, that's it. Just thanks for having me today. And you know, if anything comes up or there's questions that come later, feel free to reach out and we can try to answer them.
Definitely. Well, thank you. And I hope everyone has a good day.
All right. Thank you.
All right. Yep. Bye.
All right.